Good evening. I'm going to talk to you tonight a little bit about the Narcan Leave Behind program that we're hoping to implement within our EMS system. The program is based off of similar ones that have been implemented in different areas around the country. It's similar, but not inherently the same, because just like with any project, we have to find a way to make it work in our system. Opiate-related emergencies tax our EMS system on a daily basis, and they place a strain on our other public safety partners as well as our receiving facility partners. Narcan, for those who don't know, is a life-saving drug with a relatively low risk for adverse effects, and there's basically no true contraindications for use, so it's safe to be given by lay people in an out-of-hospital environment. Having it readily available at the homes of repetitive overdose patients will contribute to an increase in patient outcome and ultimately the overall decrease in calls for service for this type of emergency. That's not our ultimate goal. Our ultimate goal is to better take care of our patient population. But if that's a positive consequence, if you will, we'll take it. Other agencies who have implemented these programs were contacted and reported great success with goals similar to what we have stated. We actually have a resource within the state of Alabama, the Project Freedom, which serves to provide the free Narcan that we'll be able to leave behind with absolutely no cost to the agency. This whole program should honestly not cost an extra dime in the budget. The affected crews are those who will be primarily assigned to the areas with the highest amount of opiate-related overdose. They've been briefed on the program, and the feedback so far has been largely positive. Our sprint medics who respond on their own and community medics who do follow-up have also been briefed, and they're all pretty excited to launch this program. As I said earlier, there'll be no additional resources required to get this up and running. No overtime to account for, not a dime. There should not be an extra dime in the budget over this. The medication and nasal atomizers have been allocated to the agency, and they're just waiting for the go-ahead to ship, and we'll have it, and we'll be able to get started. Narcan kits containing 2 doses, 2 nasal atomizers will be placed on the selected units for distribution. We've also provided literature with information about the medication, how it works, when you should give it, and that all of that will be in the kits that will be left with patients and their families. There's also going to be a survey that will be in the kit, and we hope that somebody will fill it out so we can evaluate the efficacy of the program over time. In the event that they don't, we'll send somebody to them. A sprint medic or a community medic can stop by and attempt to gather the information. And we know that this isn't the best way to gather data, but it's probably the only way we have to truly find out if the program is working. In the event that they respond to an opiate overdose, they give Narcan, they transport, and more Narcan is going to be left behind. It's a fairly simple program. We're hoping to get good feedback. Again, that might be a challenge, but we'll work on it over time. Printouts of the survey as well as all the literature are available to you before you leave today. There's a whole lot of benefits here. Short term, we're hoping for increased patient outcome. That's what we do. That's our business. Considering we cover 1,500 square miles, that's a lot of ground. We spend a lot of time waiting for law enforcement to secure scenes, and we don't want these people to end up in cardiac arrest, secondary to respiratory arrest due to opiate overdose. Follow-up provided from the survey should, we hope, provide adequate qualitative data to establish the efficacy of the program. Long-term benefits, who knows? But for now, it's expected that we'll have a lower amount of 911 activations for opiate-related overdose. And this should help our system. I mean, it'll allow us to respond to other calls more effectively. Most of these patients, when we transport them, they end up observed for several hours, tying up already scarce hospital beds. and they get discharged. And it's expected that with the help of our community paramedics and working with local health care, addiction counseling, and mental health partners, we might be able to help these people with their addiction in the long term, which would be a great benefit. Again, short-term goals, increase patient outcome. That's what we need to do. We're hoping to see a measurable decrease in 911 activations for overdose. Mid-range goals over the next 2 years, we're hoping to see a decrease in the amount of opiate-related emergencies in our community. If the Narcan's there's a possibility that there'll be less 911 activation. Long-term goals, we're not saying we're going to solve the opiate epidemic, but we might be able to help. If we can get these people on the road to recovery, that would benefit the community at large. A lot of these people just might not know where to go to get help, and we might be able to help them with that. EMS, for far too long, the goal has been to just take people to the hospital. That's not necessarily in the patient's best interest, it's not necessarily in the system's best interest, and it's certainly not in the hospital's best interest all the time. We're a lifeline to the community. We need to change our thought process to match that. In summary, we're a nonprofit community service provider. We just happen to work in public health and safety. Our mission is not just to take people to the hospital, but to treat them and help them improve their lives. This may be a fundamental change to the thought process of traditional emergency medical work, but the time has come to make that change. Addicts are sick, just like anybody else who's sick with any other disease process. We need to treat them. We need to help to facilitate that lifestyle change that ultimately treats them. And unfortunately, we work in a broken system, and we find ourselves in a position right now where maybe we can help, maybe we can fix it a little bit. If we put them in a position to seek help and work by working with our partners, the life and safety of the community could improve. Joseph Ranseth is quoted as saying, "Be the change you want to see in the community." Be the change you want to see in the world. And right now we're in a unique position to facilitate that change in our own way. And this program is only one part of doing that. And where I believe this to be an excellent starting point and benefit untold amounts of people, the addicts, the families, the community at large. And we're very excited about it.